Good afternoon. Today I will be presenting on medically assisted treatment for opioid use disorder. So originally it was funded in the 1970s, medically assisted treatment for opioid use disorder, and very minimal changes have been made since then. Opioid is a derivative of the heroin poppy plant. Some examples of opioids are oxycodone, which is Oxycontin, hydrocodone, which is Vicodin, codeine, morphine, and fentanyl. There are many more. Those are just a few of the most popular that we hear and read about today. So the medically assisted treatment types are narcotic antagonists. These involve and include naltrexone and buprenorphine. Another one that is commonly used is methadone, which is not an antagonist. It's actually a protagonist. However, it is used in a different way, more in terms of harm reduction. It allows the patient to not feel withdrawal symptoms as harshly as they would originally, rather than completely blocking the receptors that can be seen in naltrexone and buprenorphine. So Fullerton did a treatment on retention within the use of methadone. He reviewed 9 cases exceeding 100 patients. So he had a very large group of patients. They were male and female. And he reviewed 9 of them and found that a dose of methadone above 50 milligrams was associated with a better treatment retention, meaning that they were able to continue their treatment longer without a chance of relapse. So Fullerton compared his review to another group of patients who were at 25 milligrams, and at 60 milligrams he found that the patients at 60 milligrams were actually more likely to do better with the retention. He continued watch of the patients through urine and blood samples. So he did tests 2 weeks after his intervention, and ultimately found that methadone was a highly effective treatment and reduced the risk of early death, HIV, and hepatitis. So in Grubb's study, Grubb was very passionate about the difference between abstinence-based recovery. Grubb believed that that abstinence-based recovery was not the only type of recovery, and that medically assisted treatment needed to be announced to more people. Who is responsible is a question that Grubb posed quite a bit, and they concluded that everybody is responsible. Review of 7 case studies found that the largest contributing factors to relapse and continued use of a substance were socioeconomic factors, so where somebody lives, or how they work, who they're surrounded by in terms of peers, leading to why it's so important for individuals, policymakers, health professionals should advocate for this type of treatment. So Grubb believed that this should be the first response treatment, along with, as we will discuss later, another doctor who is very similar in opinion, believe that should be the first response treatment for opioid use disorder. So Vo et al., the importance of relapse prevention. So they discussed how similar it was to the last article that I spoke on. They're very focused on relapse prevention. So they looked into gender and age and how that might affect relapse. Women relapse at a higher rate than men was something interesting that they found through their case study. And they looked specifically at men and women below the age of 24, which is something that I think is very important to look at, because there was little literature on that. Urine samples on 100% of the population was taken, and 40% found that there was non-opioid substances, and 50% opioid negative tests were also found. So Vaux definitely dedicated to the treatment as well. So Rosenberg, no approval for ages 16 to 18. Am I at 10 minutes?
No, you're at 5.
Oh, why are you snapping?
No, I was snapping because
Jesus,
can't get up there.
I was totally running out of time.
No.
Okay, I'm gonna cut this part out.
You're good. You're good.
Rosenberg 2021 found that there is no approval for ages 16 to 18, meaning that those aged 16 to 18 are not actually legally allowed to access medically assisted treatment in the United States. They also found that there was a spike of 27%, which means the spike of 27% is in deaths due to opioid use disorder, and that's just within 2020 to 2021. 80% of deaths overall are due to opioid use disorder. I have a graph here that kind of shows the trend in which it is growing. This graph goes to 2017, but you can very clearly see that from 2014 to 2017, there's a very large spike. And this spike can also, you can imagine how far it has gone since then, since Rosenberg spoke of the 27% spike now. So it is still increasing at a very high rate. As many know, fentanyl is one of the big reasons for that. So Feder et al. Found that youth were receiving 2.6% of the treatment for medically assisted treatment, while adults were receiving 26%. And my question is, what would you do if you were in someone else's shoes and you were in a situation where you were below the age of 18 to 20 and you found yourself in a situation where you were addicted to an opioid? What kind of information would you have around you? Would you have the information saying that you're able to seek treatment through medication, or would you have simply an abstinence-based approach that's directed towards you? So I think it's only fair that all people have the same amount of resources regardless of their age, and I think that's a very important note to take, the fact that youth only are at 2.6% of that. They don't have a lot of information in front of them. Meglione did a study that kind of cycled the biopsychosocial approach. So they looked at effects on social, behavioral, cognitive, physical, occupational, and neurological functioning. So current users of opioids experience problems in cognitive and social behavioral functioning. However, she did do this comparison between those who were non-drug users, those who were seeking treatment through medically assisted treatment, and those who were current drug users. And she found that current drug users had low social behavioral functioning as well as cognitive functioning. However, those who were seeking MAT had higher amounts of cognitive and social behavioral functioning. And then those obviously were just to compare to those who were non-drug users. So overall, there were mixed findings. She found that current drug users were still at lower functioning, as well as those seeking MAT. They were still at lower cognitive and social behavioral functioning. However, they were at a higher amount, so they were 90% functional in their daily lives, as opposed to those who were not seeking treatment at that time. So, in conclusion, I think it's important to focus on the small amount of literature that I found during this research in regards to patients under the age of 25 who were seeking treatment for addiction. I think it's important to note that there was not a lot of literature on the younger generations. I think that's very important. Sometimes 90% functioning could mean they are on the road to recovery. This goes back to what Meg Leone had done in their article where they had spoke about the types of functioning, and even if they're at 90% functioning on this type of methadone treatment, then they're still accomplishing more in life than they would if they were not. And I think that is another important note. There's a shocking amount of deaths. If there's anything to take away from it, it is that we have a serious opioid crisis. If 80% of deaths are due to opioid overdose, then we must do something. There is an individual level in disseminating this information. So this goes back to what Feeder was saying in their discussion on the 2.6% of youth who actually are aware of the fact that there's medically assisted treatment. So in that, I would suggest everyone to just understand and take it upon themselves to disseminate this type of information. In the back, I have a naltrexone kit. This is used for opioid overdose and can be found at any pharmacy. Thank you, and have a happy holiday.